5% of wages are from the employee, 1.45% of wages are from the employer, and if you're self-employed, you pay the whole part. Starting this year, they have an addition to that, so that if you make over $250,000 a year joint or $200,000 individual, you have a surcharge on this, so that that payroll tax part, that blue bar that you had over there on the Part A, will be higher. So this has changed, but you remember that red bar of how much was borrowed money from the general treasury? If you look at your income tax in 2011, you got the bar chart. Here is the income for Social Security and Medicare, and here is the expense. So 23% of the income came from sources dedicated to there, even after they did the shift, and 37% of the expenses went to it. So we're spending on Medicare and Social Security more than we're taking in, and there are various things that we can do about it, like President Obama's proposal that we have more cost sharing for premiums. It's very fair, but I worry about those poorer folks. Also proposing that there be a copay for home health. That's new. In the past, Medicare hasn't had copays for home health. And those brackets, he's going to lock. He's not going to let those income brackets go up with inflation. So the poorest people in that are going to drift into higher payments as inflation takes over. And so the poorer in those categories are going to wind up doing the extra payments. And I would rather see the wealthiest pay more, have that more graduated myself. And then, as I said, I actually agree with Cantor that it's an artificial decision between parts A, B, and D. So I've given you a lot of details to explain the cost and the way that we do means testing in the Medicare, because those details are the sort of things we need to understand if we're going to bellyache or say, yeah, I agree with that, as they go through budget negotiations. So with that conclusion, any questions? John?
The Part B premium that I pay monthly
Right.
is based on my income, but they don't know what my income is, other than they know, I guess, what I'm getting from Social Security, but that's about all they know. They don't go around looking at all the income tax returns.
Yes, they do.
They do.
They do. They base your premium on your income tax return from 2 years ago.
Okay.
So you have to be real careful, because when they're setting your premium at the beginning of 2013, they don't have your 2012 filing yet. So they look back at 2011. So it's 2-year-old data. So if your financial situation has changed, you need to understand that, hey, wait, I retired. I don't make that much money anymore. And you can file a form then. But most people don't know that under certain circumstances, you can appeal that charge and go back and have it lowered because your circumstances have changed. So they have to use 2-year-old data. And that's part of why I only gave you 2010 and 2011 tables on here. 2012 data is still forecasted because they haven't done all the spreadsheets for the income tax that has come in for payroll and all. So, Carl?
My opinion is that whenever people are talking about something like this, they never have a job rate changing, unemployment decreasing, and jobs are created. I just wonder if it really had an effect on that. If we had our middle class back, would it affect this whole thing?
Yeah, sure. You'd have more payroll tax if you had a higher unemployment rate. But in spite of our recession, this has been in the black in terms of the Part A part. Part A has been paying okay.
Now, in my opinion, also, the Republicans want the employers to not have to pay any matching funds. Most of the thing goes out here. They're getting away from that. Employers are getting away from paying matching funds, aren't they, on some things?
Not that I know of. I don't think there's any talk of the employers escaping.
This is Social Security, but if it was, I wonder if that's
I don't.
effective of the Republicans, if they were to privatize it, would they do away
I have not seen any proposal to say that the employers would stop paying. So I don't think that's on the table, although when you look at the Social Security part, you know, that 7% from each is a lot. And so that, you know, you don't want to have that keep creeping up. And because we are living so long and so many of us are entering retirement and Medicare, the number of people working to supply this per recipient has gone down. I think when it started, it was over 8 workers per recipient, and now it's down to less than 3.
That's my point I was talking about. They keep decreasing the number of employees that.
Yeah.
And if we had the jobs recreated here, it would help.
Yep, and it does. It varies from year to year with the employment wages. And during the .com in Clinton, that looked good with people coming in. But remember that capital gains and a lot of these revenues that the really wealthy make are not subject to payroll taxes. We tax people for work, but we don't tax people for their financial gains. They don't have to pay those payroll taxes. So I disagree with that. I would tax capital gains like regular income, and I would put these payroll taxes into the category of taxing all income at a lower rate myself. But, you know, I just don't like seeing capital gains getting all these silly special treatment.
Is that ever been proposed, what you just said,
Um,
capital gains?
Bernie Sanders has a bill out there, and can't remember the name of the House fellow. I just can't remember his last name. But yeah, there are bills there, but they don't have any kind of popular support. And we can't even get with, you know, 70 to 90% of the population wanting the background check for guns. It still can't pass. So it's pretty infuriating that what we want doesn't happen. So any other comments, or John?
I don't want to monopolize this, but I do have a second question or comment. I think everybody in here probably agrees that the private insurance is more costly than government-paid insurance. Or
Yes.
taxpayers pay.
Yes,
And yet, and therefore we ought to have a single payer. Everybody
I agree.
probably agree with that. However, Medicare is administered by private outfits.
They subcontract for the bills and the collection and the oversight for fraud and abuse, but it's not a true social program because the hospitals and the doctor's offices and the x-ray machines and the labs are owned by private entities. So those products of economics are not owned by the government, so it's not a true social medicine program, but it's a social insurance.
I guess my thinking was that if the government employed a couple 100,000 people, however many it might take, that the administration of Medicare could be done more cheaply than it's being done right now.
It's done really inexpensively. I don't think they'd cut the bills much. And one of the things I put up was the Time article, The Bitter Pill by Stephen Brill. That was just, it's 39 pages long, but it discusses the hospital charges and how capricious they are with the charge master. So that's a really good article discussing some of the problems we have with how we charge. I agree with you that a single payer would be more effective. I don't have a problem with what things they subcontract in Medicare. They still keep their administrative costs incredibly low. It's on here somewhere in this table. So, you know, it's less than 6%. I think it's like 3%, 2.3%, unlike the private companies that go up to 25% in their administrative charge. And so while I've got the audience, that last slide over there on the poster board is information about the TennCare expansion in the Affordable Care Act. That was the expansion for the folks under 138% of poverty. And as you know, on March 27th, the night I went to bed and cried, our governor refused the Medicare funds in his announcement to the General Assembly. I hope every one of you get in touch with him often to say that you think that's a bad executive decision. TennCare is not Obamacare. TennCare is Tennessee Care, and we have evolved that over the 20 years that it's been in existence. into something that is cost efficient and high quality. It has a 93% approval rate from its recipients. It costs, anticipated for 2014, about $5,200 a year per recipient, and that is less than the national average, and TennCare costs are increasing slower than the national average. If he sends folks to the private plan, those under 100% of poverty won't have any coverage. They won't be eligible for TennCare. They won't be eligible for the exchanges if they are adults 19 to 64 with no child at home. So he's leaving a donut hole by not accepting it, and he's making it more expensive for the ones from 100 to 138 who go on the exchanges. The private plans, as you say, are not less expensive than the government. And TennCare is Tennessee's plan, and it's good. So, my spiel. So please sign my petition if you haven't that we're putting together. Yes?
I have a question. If you're a patient and you are admitted to the hospital under observation as opposed to just as a regular patient, who bears the cost for that?
If you're as an outpatient in observation, it comes from the Part B, as in boy. So it comes from this pool of money.
So would the patient, I had heard that the patient, that some people I have read end up having a huge bill, even though they were in the hospital, because they were listed as observation and not just a patient in the hospital.
Your bill for the year may be higher if you have 12 observations rather than 3 inpatient stays. Then your copay, as you accumulate your copays through the year, is going to be higher. And so you've got your copays and your deductibles, and I think Part B is $147 per year for your outpatient deductibles, but you could, in your copay part, wind up spending more.
Actually in the hospital, but they have you listed
As observation. Yeah, and that's why I say as a doctor, I don't take care of you any differently if I've got you as observation or inpatient. And there are certain rules about going to inpatient. You have to meet certain illness criteria. And if the doctors aren't quite sure and they're pretty worried about you, they may put you in observation, and then if you get sicker, they convert you over to inpatient and you don't have those other observation charges. So this is an artificial delivery, and like I said, I only agree with Eric Cantor on one thing, and that's that it's an artificial division.
I just know that there are some people who are just unaware, because you're so used to that when you're in the hospital and you're actually staying, you don't think you're bearing that cost.
Yep.
Yeah, and they don't know the difference between being listed as observation staying in the hospital or the other and you're in the hospital. When they were dismissed, they didn't have a bill that they had.
And if you are a SLIMB person earning $13,600 per year, you just get your Part B premium paid for. You don't get any of your copays or your deductibles paid. If you're really poor and you're in Quimby, then everything gets paid. But if you're in this and you have multiple observations, you really pay the piper. So you're right.
Prescription drugs and donut holes.
They're supposed to phase out, and in President Obama's request for the budget changes to Medicare, he has asked for a quicker closing of that donut hole by a higher payment from the pharmaceutical companies. But we really need these costs for Part D, the prescription drugs, could be much less if we would negotiate for our drug prices. That's 54 million people in there, and if we negotiate those drug prices, it could be far less. So that's a very unsatisfactory situation that the drug prices aren't negotiated for this big pool.
Okay, if I could just share a story.
Sure.
In January, I went up for my health care checkup, and they said I was great, and I said, I got a little patient in my shoulder, so I went back and was stress tested, and then they put 4 stents. Now, that's not all that bad, because you go in on Friday, you're out by Saturday, and everything's hunky-dory. But when I back for the checkup on Wednesday, he said you need to be on a blood thinner. Plavix will do. I said, what I always say, do you have a generic? And he said, yes. So I went to Targets, and I said, how much much for the generic of this, and they said, oh, it's called clopidogrel, it's $126 for 30 days. So I walked down the row of buildings and I went to Kroger's. And he said, oh yeah, that's clopidogrel, and it's $55. So I called down, because I was in Michigan, I called down to Tennessee to my pharmacy and I said, what is this? They said, oh, it's clopidogrel, it's $15. So when I went into Knoxville, as I do every Friday morning, for some reason I stopped at Kroger's. And I said, do you have this? They said, yeah, it's clopidogrel. How much should they charge? How much? $197. Okay? Well, what the big box stores don't tell you is they buy them as generics, but they don't have to sell them that cheap. They pick out a price. And there's a lady there, her name is Anna, she was 87 years old, she's living in a retirement home, and she's fine. She's got all her prescriptions and everything she needs, and life is good, and she's got a buffer of finances, but her son, Mark, is out of work, and he's uninsured, he's only 55. She's paying $2,100 a month for his meds. When we went back to the generics, to the local independent store, we got his meds for $187. Okay, nobody talks about that. But is there any reason you would want to pay an extra couple $1,000s a month needlessly when nobody's discussing it?
And the other thing is, as a physician, I have a usual and customary charge. So if I see you as a new patient, that is just set. I can't say, well, he's got gray hair and he's got black hair and she's got blonde hair and charge you 3 different rates. It's set by Medicare. All in your community, it's a set charge, and yet you have these variations in the pharmacy cost. So I don't understand why my charges are fixed and their charges are not.
Do any of the people here, what did you call that program you told me to go down to try to get a protest going? I forget what you called it. There were a couple places you sent me to.
You mean for petitions?
Petitions.
Yeah, signon.org, moveon.org, petitions.org.
National Public Radio the other day said that the drug developers, the big pharma, is suing manufacturers of generics for whatever reason. And generic manufacturers usually win over 70% of the cases. But this time, the two of them got together. And the manufacturers of the drug said, I'll tell you what, we will pay you $425 million a year not to make the generics for 9 years. So you as a group get to pay full boat for 9 more years. We already give the drug companies, when they have a patent, 17 to 20 years. Now they want another 9. So you should know that, so you might want to talk to somebody about it.
The petition organization that was the most successful in my review of those and looking nationwide was care2.org. They seem to be able to generate the most participation in 50 states. So, well, thank you for, yeah, Carl?
Whenever they get up there and want to get rid of Obamacare
Yeah.
and not explain anything at all, what are they really basing that on, in a sense that they are objective to it that much?
The arguments that I hear are that they want everything in the private sector, that they want free enterprise. And I don't think we ought to have all toll roads and